I continue. Now, how does cognitive behavior is used? Cognitive behavior of Dr. Beck is used for relieving the pain. You see, I talk to many clients that they have chronic pain. It amazes me that I ask them, why do you have pain? Have you studied the pain? Have you seen what other alternatives are to relieve your pain? Most of them don't know. So this is, at least, if you don't know, I believe this can be some value to you. Leave me a comment what you got out of it, please, after I explain what cognitive behavior for relieving of pain is. Okay. What happens is when we get, for example, we have acute pain. There are two types of pain. Acute pain is something that damage happens to our body. Let's say somebody gets fall down and breaks their hand. So this information goes to the brain. In brain, this information also, after brain receiving it, goes the feeling part of the brain, right? Also, this feeling part, then of course you are hurting, and you, over the time this information going, the brain assigns the action part of the brain, assigns some pain to the hand, so you know uh, to take care of it. Obviously you see it, but if there was no pain, for example, some diabetic people, if they get their feet, they get something inside of the glass or nail gets in their feet, they may not know. So knowing, and there are some people that do not feel the pain, very low percentage of people. So if you get a pain, it's a good thing. It is letting you know there is something wrong. You need to take care of it. That's what acute pain is immediately. Now, over the time, this memory is registered our brain. So when you get this becomes repeating itself, and you always uh, it lasts more than basically 6 weeks, or some people say 3 to 6 months. That is called chronic pain. Now, how to get rid of chronic pain? Lots of times, not always. The chronic people have chronic pain on their MRI. For example, I give you example of back pain. They do not have any sign of problem in the back, but they're still suffering from the pain. And the scientists, neurologists, and psychologists that have studied the pain say that because our brain thought about the pain for the longest time until we got healed, so that emotions are in the brain. So that one misfires sometimes, especially realize this. Do you feel same amount of pain when you are with friends, having party, enjoying yourself? Or do you get, I talk to my client, always the answer is yes. So when they are stressed out, they get more pain, like the pain magnifies. That is why in 50s, two neurologists from one from Canada, I believe Dr. Robert Maslow, I forgot his last name, I apologize, with another British scientist. They came up with gate theory. Gate theory, it says, like you are having problem, somebody going through divorce or got fired from the job, they're gonna have more pain. Meaning, in it's a theory. If the gate is open and the information nociceptor shoots up to the brain, brain assigns more pain to that. When the gate is closed, the information does not go to brain. So if it goes, it's not much. So you don't feel as much pain. So now, highlight is, what do you do with cognitive uh, therapy of reducing the pain? You see, you have thought about the pain, let's say for 2 3 months until you got healed. And I understand everybody goes through pain. I've had pain. So you have built a neurology that constantly complain, which is, you have the right. I'm just saying that you were hurting. What you need to do, you retrain the brain little by little. It can happen for, I've had clients, it happens for them immediately. I've had some, for some reason, I guess they had more stress. It took some time to release. So what you do is, even you have pain, say you don't have pain. That it goes with the lemon theory. If you think about a lemon, you cut it, imaginary lemon in your hand, close your eyes, then you cut it, you bring it to your mouth, and you squeeze it, imaginary. Right now that I'm talking about lemon, the saliva is putting all over my mouth. The mind really does not know the unconscious mind. The difference between reality and the truth. Try with the lemon. If that makes sense to you, now, the more you say you have pain, guess what? The more pain you're going to have. In cognitive therapy, they can teach you that you need to talk less about it. I guarantee you, with meditation, you can do it. With hypnotherapy, you can do it. Just bring it to yourself. The more you say you are tired, you are upset. I give my client this analogy. One day in the morning, get up. If you're feeling bad, you say, I feel good, I feel good. At the end of the day, you will feel a lot better than you started with. Or I hope I don't suggest you try this. If anybody gets up in the morning and says, I don't feel like going to work, I don't feel good, I'm upset today, you repeat that many times, even you are good, if you want to prove it to yourself. I guarantee you it's scientifically true, you are not going to feel good. So there are many different methods. I urge you, as acupuncture, biofeedback, cognitive therapy, meditation, loving kindness, all of these system works. You start doing them and you do. My message is, I am a vessel to make sure that people don't have pain, because I've had pain. What it does is it robs your life mobility, and also you cannot go to work that comfortably, or you can spend time with family members. You are not whole, you are not healthy. You see, I'm not saying don't take medicine. Medicine is basically makes you feel better. I hope it doesn't bring addiction. In some cases does, the opiates. But also have an open mind and heart. Try alternatively. You'll see that it can benefit you. With that said and done, good luck. If you have any comment, any question, ask me. I'll be glad to answer it. Take care and have a good one.